This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to explain what causes heel pain. So there's a bunch of different reasons you can have heel pain. Let's start with the most common. So the most common is plantar fasciitis, and that'll be pain at the bottom of your heel. So plantar fasciitis is, there's something called the plantar fascia, which kind of helps with the arch of your foot, and that's on the bottom of your foot. And sometimes that can get stressed or irritated, and it ends up causing pain on the bottom of people's foot. And it's really one of the most common causes of heel pain. What you'll notice if you have plantar fasciitis is that if you haven't walked in a while, or let's say you're sitting down or you're waking up in the morning, that those first steps are really killer. And then as as the day goes on, it tends to get better. So that's the most common thing, and that usually can get better, with some stretching and a little bit, some anti-inflammatories and some rest. So if you have heel pain and it's on the bottom of your heel, chances are that's what it is. Something else that can cause pain on the bottom of the heel is something called fat pad atrophy. So in everybody's foot on your heel, you have a bunch of fat there, which acts as a cushion. This is a much less common diagnosis, more seen in older people, or someone who's had steroid injections into that area. Let's say someone gave you steroid injections for your plantar fasciitis, which is not something I generally do. That can cause atrophy of the fat in your heel, and that can be a source of pain. But again, not a super common diagnosis. If you have pain on the side of your heel, there's something that is called Baxters neuropathy. So there's this little tiny nerve. It's a branch of the lateral plantar nerve, which is just a nerve to your foot. And sometimes that can get compressed for various reasons, and that'll also cause heel pain, although certainly less common than plantar fasciitis. Two other things that can cause it: if you have pain more in the back of your heel, your Achilles tendon can always be irritated. You could have Achilles tendonitis, which is another common issue, and that can usually go away with just some rest and stretching as well. Another thing that you can have, if your heel hurts and you squeeze your heel and it hurts, you could have a calcaneal stress fracture, meaning that you've actually broken the bone in the bottom of your foot. This can happen if you've been running a lot or increased your activity or something like that, or in Army recruits. That's something that usually requires a period of non-weight bearing and rest to get rid of. So heel pain can kind of be a tricky area. Just to sum it up, you can have plantar fasciitis, common; heel fat pad atrophy, not common; Baxter's neuropathy, not that common; Achilles tendonitis, common; and calcaneal stress fracture, which is not that common. So the goal to getting better and relieving your heel pain is really to figure out which one of those things it is. And it's a tricky area, so it helps if you can have a doctor or diagnose it for you. And then once you get the diagnosis, then you can start doing treatments. But it's certainly a frustrating area and can be a confusing area. So I hope this video helped explain why your heel may be hurting or what could be causing it. If you have any questions, feel free to leave a comment below and I'll do my best to respond. If you like this video, we put out new videos every Friday, so please like and subscribe. And thanks for watching my video.